What if I told you that one of the two numbers on your blood pressure reading is far more dangerous, especially after age 60, and it might not be the one you're watching? This crucial detail, often overlooked, is hiding in plain sight on every blood pressure measurement you've ever had. You've seen these two numbers, one over the other, hundreds of times. Your doctor mentions them at every visit. But here's what nobody has clearly explained to you. One of these numbers is significantly more perilous than the other, particularly as you age. And the number that's causing more harm to seniors might not be the one you're currently monitoring. I'm Dr. Claire Whitmore, and after 20 years as a cardiac surgeon, I've operated on thousands of hearts damaged by high blood pressure. I've held failing hearts in my hands, witnessed the devastating effects of countless strokes, and watched families torn apart because someone focused on the wrong number, ignored the real threat, and paid the ultimate price. What I'm about to share is based on decades of research involving millions of patients. This isn't theory. It's proven, life or death information that every person over 60 needs to understand. By the end of this video, you will know precisely which number poses the greatest threat to your heart, your brain, and your life. You will understand why it becomes more dangerous with age. And most importantly, you will know exactly what steps to take starting today. This could be the most important 15 minutes you spend this year, so stay with me, because the answer might truly shock you. Let's begin with the fundamentals, so you can truly grasp what these two numbers represent. When a doctor or nurse wraps that cuff around your arm and it tightens, it's measuring the pressure of blood pushing against your artery walls. However, blood pressure isn't static. It pulses with every heartbeat. That's why you receive two numbers. The top number, the systolic pressure, indicates the maximum force when your heart contracts and propels blood into your arteries. Imagine it as a wave crashing. That's the moment of peak pressure. The bottom number, the diastolic pressure, reflects the minimum pressure when your heart relaxes between beats. It's the calm between those waves. So, if your reading is 150 over 90, it signifies that your peak pressure is 150 millimeters of mercury, and your resting pressure is 90. For decades, medical professionals focused intently on both numbers. If either was elevated, it indicated high blood pressure and required treatment. Yet, over the past 30 years, as researchers have meticulously followed millions of individuals for decades, tracking who experiences heart attacks, strokes, or succumbs to cardiovascular disease, a distinct pattern has emerged. This pattern becomes increasingly pronounced the older you get. Let me illustrate this with the stories of two patients, which will help you grasp the revelation I'm about to share. The first was Margaret, a 73-year-old, who came to me for a routine cardiology evaluation. Her blood pressure that day was 165 over 70. Margaret was delighted, telling me, "Dr. Whitmore, my bottom number is perfect. I've worked so hard to keep it under 80, and look, it's only 70. I know my top number is a little high, but my doctor said as long as the bottom number is good, I shouldn't worry too much." I wish I could say Margaret's doctor was correct. However, 6 months later, Margaret suffered a massive stroke. The left side of her body was paralyzed, and her speech was slurred. The independent, vibrant woman who had walked into my office was now entirely dependent on her daughter for every basic need. The cause: years of elevated systolic pressure had silently damaged the arteries in her brain, while everyone celebrated her seemingly excellent diastolic number. My second patient was Robert, 68 years old, whose reading was 128 over 95. Robert was consumed with worry. He told me, "Doctor, my bottom number has been gradually increasing for years. I read online that diastolic pressure is the real killer, the one that indicates your heart is constantly working too hard. I'm terrified I'm going to have a heart attack. I conducted a complete cardiac workup for Robert, including a stress test, echocardiogram, and coronary calcium score. His heart was healthy, and his arteries showed minimal plaque. While we certainly needed to address that diastolic number, his risk was nowhere near what he feared. 2 patients, 2 distinct patterns, and completely different outcomes. This brings us to the critical question you're here to answer. Which number is more dangerous, systolic or diastolic? Before I reveal the answer, it's crucial to understand that this question does not have a universal answer. The threat posed by each number differs significantly if you are 30 versus 70 years old. Your age fundamentally alters which number presents the greater risk. Given that my audience is primarily individuals over 60, I will focus specifically on what the research indicates for your age group, as this is where the answer becomes unequivocally clear and where understanding it can genuinely save your life. The groundbreaking research that reshaped our understanding originated from multiple massive studies. The Framingham Heart Study, for instance, followed over 5,000 people for decades, while the MRFIT study tracked more than 300,000 men. Study after study, involving millions of participants, consistently pointed to the same conclusion. After age 60, systolic blood pressure is a far stronger predictor of cardiovascular events than diastolic pressure. In fact, some studies demonstrated that for older adults, systolic pressure was 2 to 3 times more predictive of heart attack and stroke risk than diastolic pressure. What's even more intriguing is that researchers observed a peculiar phenomenon. In many older adults, systolic pressure rises, while diastolic pressure remains normal or even decreases. This condition is known as isolated systolic hypertension, precisely what Margaret experienced. For years, medical professionals were uncertain how to manage it. Some speculated that if diastolic pressure was normal, perhaps it wasn't true hypertension, merely a sign of normal aging. We now unequivocally know that this perspective was catastrophically incorrect. Isolated systolic hypertension is not benign. It is not simply aging. It is a dangerous condition that dramatically increases your risk of heart attack, stroke, heart failure, and kidney disease. Studies have conclusively shown that treating isolated systolic hypertension reduces stroke risk by 30% to 40%, and heart attack risk by 15% to 25%. These are profound numbers, representing the prevention of thousands of deaths and disabilities annually. Therefore, let me be absolutely clear. If you are over 60 years old, your systolic blood pressure, that top number, is the most dangerous figure on your blood pressure reading. This is the number most likely to predict whether you will suffer a heart attack or stroke. This is the number you must monitor meticulously, like a hawk. This is the number that absolutely needs to be controlled. Now, does this imply that diastolic pressure is irrelevant? Absolutely not. It matters profoundly, but in a different way. And understanding this nuance is crucial because it directly influences how your doctor should approach your blood pressure treatment. Let me explain the underlying physiology, because once you understand why systolic pressure becomes more perilous with age, everything will make more sense. Your arteries are not rigid pipes. They are elastic tubes that expand slightly with each heartbeat and then recoil. This elasticity, this capacity to stretch and rebound, serves a vital function. It absorbs some of the peak pressure from each heartbeat, smoothing out the force and shielding your organs from constant pounding. When you are young, your arteries are flexible and expand easily. This keeps your systolic pressure relatively low and your diastolic pressure relatively high, as the arteries still exert pressure during the resting phase. However, as you age, your arteries stiffen. The elastic fibers in their walls break down and are replaced with stiffer collagen. Calcium deposits can form, and atherosclerotic plaques develop. Your arteries transform from being like supple rubber bands to rigid tubes. Now, when your heart contracts and propels that wave of blood into stiff arteries, those arteries cannot expand and absorb the pressure. Consequently, the systolic pressure surges. But during the resting phase between beats, these stiff arteries do not recoil as effectively, causing the diastolic pressure to often remain normal or even drop. This is precisely why isolated systolic hypertension is so prevalent in people over 60. It is a direct consequence of arterial stiffening. Here's the critical point. Elevated systolic pressure is not merely a harmless marker of stiff arteries. It actively causes damage. Every time your systolic pressure spikes, it relentlessly hammers your vital organs, your brain, kidneys, heart, and eyes. The delicate blood vessels within these organs are injured with every single heartbeat. Imagine waves incessantly striking a seawall. A few large waves might cause little damage, but thousands of waves, day after day, year after year, will inevitably crack that structure. That is precisely what elevated systolic pressure does to your blood vessels. It creates microscopic injuries. Your body attempts to repair them, but this repair process leads to further stiffness, increased inflammation, and more atherosclerosis, creating a vicious cycle. The brain is especially vulnerable. The small blood vessels supplying your brain tissue cannot withstand chronic high pressure. They can develop microaneurysms, tiny weak spots that may rupture, causing a hemorrhagic stroke, or they can become narrowed and blocked, leading to an ischemic stroke. Even if you never experience a major stroke, chronic high systolic pressure causes thousands of tiny, silent strokes. Microscopic areas of brain tissue die, and over time, this leads to vascular dementia, characterized by memory loss, confusion, and personality changes. Many cases commonly attributed to Alzheimer's disease are, in fact, vascular dementia resulting from years of uncontrolled systolic hypertension. Your heart also suffers. This vital muscle must generate enormous force to push blood into stiff, high-pressure arteries. Over time, the heart muscle thickens in an attempt to meet this demand. This thickening, known as left ventricular hypertrophy, is dangerous. A thickened heart is a stiffer heart. It doesn't fill properly or pump efficiently. This is how heart failure develops, not from a single heart attack, but from years of your heart working overtime against elevated systolic pressure. Your kidneys contain millions of tiny filtering units, each supplied by delicate blood vessels. Elevated systolic pressure damages these vessels, leading to kidney disease. Once your kidneys begin to fail, they lose their ability to regulate blood pressure effectively, which exacerbates the hypertension and further damages the kidneys. This is another vicious cycle that can ultimately lead to dialysis. Now, this is a point where many people become confused, and I need to address it directly. Does a low diastolic pressure mean you are safe? Absolutely not. In fact, a concerning phenomenon occurs in some older adults with very stiff arteries. Their systolic pressure is very high, but their diastolic pressure is very low, sometimes below 60 or even below 50 millimeters of mercury. This creates a very wide pulse pressure, which is the significant gap between systolic and diastolic readings. A wide pulse pressure is, in itself, an independent risk factor, indicating severe arterial stiffness. Here's the tricky part. That low diastolic pressure means that during the resting phase of the heartbeat, the pressure in your arteries drops significantly. Your coronary arteries, the vital vessels that supply blood to your heart muscle, fill primarily during this resting phase. If the diastolic pressure is too low, your heart muscle might not receive adequate blood flow. This can lead to angina or chest pain and even heart attacks, despite having open coronary arteries. This condition is known as demand ischemia. So, the ideal situation for an older adult is not a sky-high systolic pressure coupled with a very low diastolic. The ideal is to have both numbers well controlled. However, if we must prioritize, if we must identify which number is most critical to bring under control, the evidence is unequivocally clear. It is systolic pressure. The top number, the one that spikes with every heartbeat and relentlessly pounds your organs. Let me share what the current medical guidelines recommend, as this information is vital for your next doctor's visit. The American College of Cardiology and the American Heart Association updated their guidelines in 2017, lowering the definition of hypertension to 130 over 80 millimeters of mercury. This means if your systolic pressure is 130 or higher, or your diastolic is 80 or higher, you are considered to have hypertension. Crucially, they also emphasize that for older adults, systolic control is the primary goal. For most individuals over 65, the target is to achieve a systolic pressure below 130 millimeters of mercury. Some guidelines suggest that for very healthy older adults, even lower targets, such as below 120 millimeters of mercury, might be beneficial based on the SPRINT trial, which demonstrated dramatic reductions in heart attack, stroke, and death with intensive systolic control. However, for frail elderly individuals, particularly those over 80 with multiple medical conditions, slightly higher targets may be more appropriate to avoid complications from overly aggressive treatment. The key takeaway is this. If your systolic pressure is above 130 millimeters of mercury, you need to take action. You must work with your doctor to bring it down. And if your doctor dismisses an elevated systolic pressure because your diastolic is normal, you need to initiate a serious conversation. Present them with the research. Ask specifically about treating your isolated systolic hypertension. Your life may genuinely depend on it. So, what about treatment? How do you effectively lower that systolic number? The solution involves both crucial lifestyle changes and, often, medication. Let me guide you through both, as a comprehensive strategy is essential. Lifestyle modifications are foundational. First, sodium restriction is paramount for blood pressure control, especially for systolic pressure. Most people consume over 3,400 milligrams of sodium daily. For individuals with hypertension, the recommendation is a maximum of 1,500 to 2,000 milligrams. Reducing sodium intake can lower systolic pressure by 5 to 10 points, which is substantial. Eliminate processed foods, avoid adding salt at the table, and meticulously read food labels. This single change can enhance the effectiveness of medication or, in some cases, reduce the need for it. Second, weight loss is vital if you are overweight. For every kilogram you lose, that's approximately 2 pounds, you can expect your systolic pressure to drop by about 1 point. Losing 5 kilograms, for example, could lead to a 5-point drop. Combined with sodium restriction, you could see a potential 15 to 20-point systolic reduction from lifestyle changes alone. Third, engage in regular aerobic exercise. Walking, swimming, cycling, or any activity that moderately elevates your heart rate for 30 minutes most days of the week is beneficial. Exercise offers multiple positive effects on blood pressure, including improving arterial elasticity over time. It's not solely about weight loss. The exercise itself acts as medicine. Fourth, limit alcohol consumption. If you drink, do so in moderation. More than 2 drinks per day for men or 1 for women can significantly raise blood pressure, particularly systolic pressure. Fifth, prioritize stress management. Chronic stress elevates cortisol and adrenaline, both of which increase blood pressure. Incorporate practices like meditation, yoga, or deep breathing exercises, whatever helps calm your nervous system into your daily routine. However, here's the reality. For most people over 60, with systolic pressures above 140 or 150 millimeters of mercury, lifestyle changes alone will not suffice. Medication is almost always necessary, and I need to be very clear on this point. Taking blood pressure medication is not a sign of failure, nor does it mean you haven't tried hard enough. For older adults with stiff arteries and elevated systolic pressure, medication is frequently life-saving. There are multiple classes of blood pressure medications, including diuretics, ACE inhibitors, ARBs, calcium channel blockers, and beta blockers. Each works differently, and many individuals require 2 or 3 medications to adequately control their systolic pressure. This is normal. It is not excessive. Your doctor will select medications based on your other medical conditions. For example, if you have diabetes, certain medications protect your kidneys, while others assist heart function if you have heart failure. The crucial aspect is finding the right combination that effectively controls your systolic pressure without causing intolerable side effects. If a medication makes you dizzy, causes a cough, or creates any other issue, inform your doctor immediately. Do not simply stop taking it. Instead, ask about alternative options. With so many available choices, almost everyone can find a regimen that works for them. And here's another critical point. Once you begin medication, you cannot simply check your blood pressure at the doctor's office every 6 months and assume everything is fine. You absolutely need to monitor it at home. Invest in a good quality home blood pressure monitor that has been validated for accuracy. Check your pressure in the morning and evening for the first week of any new medication or dose adjustment. Once your readings are stable, check it at least weekly. Maintain a detailed log and bring it to your appointments. This data is incredibly valuable for your doctor to optimize your treatment. Some individuals experience what is known as white coat hypertension, where their blood pressure is normal at home but spikes in the doctor's office due to anxiety. Others have masked hypertension, where their pressure appears normal in the office but is elevated at home. This is actually the more dangerous scenario. Home monitoring captures both of these patterns, providing you and your doctor with an accurate, day-to-day picture of your blood pressure. Now, let me address a common sentiment I frequently encounter. People often say, "But Dr. Whitmore, my father lived to 90 with high blood pressure and never took medication. Why should I?" The answer is survivorship bias. For every individual who lives a long life despite untreated hypertension, there are many more who succumb to stroke or heart attack in their 60s or 70s. You don't hear their stories because they are no longer here to tell them. The scientific data is overwhelming. Treating elevated systolic pressure saves lives. It prevents strokes, heart attacks, heart failure, and kidney failure. The number of people who need to be treated to prevent one cardiovascular event is remarkably small. We are talking about treating 15 to 20 individuals to prevent one stroke or heart attack over 5 years. Those are excellent odds for medications that are generally well tolerated. Another frequent comment is, "I feel fine. My blood pressure is high, but I have no symptoms. Why treat something that isn't bothering me?" The reality is that by the time high blood pressure causes noticeable symptoms, massive damage has already occurred. A stroke happens suddenly. A heart attack strikes without warning. Your body does not provide a gentle warning that your systolic pressure has been excessively high for too long. The first symptom is often the catastrophic event itself. This is precisely why hypertension is dubbed the silent killer. It doesn't announce its presence. It quietly works, year after year, damaging your arteries, weakening your heart, and setting the stage for disaster. Waiting for symptoms is waiting too long. Let me also debunk a dangerous myth. Some people believe that blood pressure naturally rises with age and that we shouldn't intervene. They think treating blood pressure in older adults causes more harm than good, fearing that lowering pressure too much will reduce blood flow to the brain and cause falls or confusion. This belief is largely false. While we must be thoughtful about not dropping pressure too rapidly or excessively low in very frail elderly individuals, the vast majority of people over 60 benefit enormously from blood pressure control. The HIVET trial, for instance, specifically studied individuals over 80 with hypertension and found that treatment reduced stroke by 30% and death from any cause by 21%. Treating blood pressure in older adults does not harm them, it protects them. The key is to do it appropriately, with careful monitoring and adjustment. Now, let me consolidate all this information into clear, actionable steps. If you are over 60, here is precisely what you need to do. First, know your numbers. When was the last time you checked your blood pressure? If it has been more than a month, get it checked this week. If you do not own a home monitor, purchase one. They are inexpensive and widely available. Ensure it has been validated for accuracy. Second, pay specific attention to your systolic number. If it is above 130, and especially if it is above 140 millimeters of mercury, you must discuss treatment with your doctor. Do not allow anyone to dismiss it because your diastolic reading is normal. Isolated systolic hypertension in someone over 60 is dangerous and unequivocally requires treatment. Third, implement lifestyle changes regardless of your current numbers. Even if your blood pressure is normal now, these changes will help maintain that healthy state. Reduce sodium intake, maintain a healthy weight, exercise regularly, limit alcohol, and manage stress. These are not optional add-ons. They are foundational to your health. Fourth, if your doctor prescribes blood pressure medication, take it consistently. Set alarms, use a pill organizer, and integrate it seamlessly into your daily routine. Missing doses causes your pressure to fluctuate, which can be more detrimental than consistent mild elevation. Consistency is paramount. Fifth, monitor your blood pressure at home and meticulously keep records. This empowers you and provides your doctor with invaluable real-world data, transforming you from a passive patient into an active partner in your care. Sixth, never stop or alter your medication without first consulting your doctor. I cannot stress this enough. Suddenly discontinuing blood pressure medication can cause a dangerous rebound spike. If you experience side effects or have concerns, contact your doctor. Adjust the plan together. Do not go rogue. And seventh, get regular checkups. Blood pressure control is not a set it and forget it endeavor. Your needs evolve over time. Your kidney function changes, other medications may be added, and your blood pressure regimen may require adjustment. Stay actively engaged with your healthcare team. I want to conclude by bringing you back to Margaret, the patient who suffered a devastating stroke because her elevated systolic pressure went untreated. I think about her frequently, not because her case was unusual, but because she represents thousands of individuals currently walking around with the same pattern: elevated systolic pressure, normal or low diastolic, mistakenly believing they are fine because one number appears good. If Margaret had understood what I've explained to you today, if she had known that her systolic pressure of 165 millimeters of mercury was the true danger, if she had insisted on treatment, I genuinely believe she would still be independent, still gardening, still living life on her own terms. But that crucial knowledge never reached her. She trusted a system that failed to clearly communicate which number mattered most. You now possess that knowledge. You understand that after age 60, your systolic blood pressure is the critical number, the dangerous number, the one most likely to predict your cardiovascular future. You understand why it rises with age due to arterial stiffening. You understand that treating it can prevent stroke, heart attack, heart failure, kidney disease, and even dementia. And you understand that treatment works and is generally safe when administered appropriately. This information is power, but only if you choose to act on it. Check your blood pressure, talk to your doctor, implement the lifestyle changes, take your medications if prescribed, monitor your progress, stay engaged. Your heart, your brain, your kidneys, your very life all depend on keeping that systolic number under control. Your heart has been beating faithfully for over 60 years, billions of times, with every single beat. It profoundly deserves your attention and your care. Controlling your systolic blood pressure is one of the most important actions you can take to protect it. Do not let that top number deceive you into thinking everything is fine when it's elevated. It is the one to meticulously watch. It is the dangerous one. And now you know.